Welcome to this episode on the event of Mia Summit being hosted in the UAE. I'm today joined by two friends and two renowned physicians, Dr. Matteo Vigo, welcome.
Thank you so much.
And Dr. Lyor Hanan. Thank you for joining me this morning. Dr. Matteo, maybe a bit more than a year now on the
Mia and a month
journey. I remember we had a long discussion a year back or a bit more, and you made the decision to onboard on this journey. What made you take that decision, invest in Mia and the journey, in learning about Mia and offering Mia to your patient base?
Basically, when Mia was introduced to me many years ago on an event, I really look at it like it's the future. It's something that I really want to offer to my patients. The moment that was offered in the UAE 1 year ago, more than 1 year ago actually, in this office exactly, we were here and I said, Andre, I really want to be part of it. And I'm specialized in breast surgery, so I do a lot of consultation for the breast surgery, and I know that the patient always wants something minimally invasive. They don't have time to recover. So all the options that Mia was offering was absolutely, attracting for me and my patients. So that's why I decided to go ahead.
Great. We'll get back to see how the journey has been. Dr. Lyor, also, what made you really join Mia? How difficult of a decision was it for you to embrace Mia?
So at the beginning, I was quite wondering how is it possible to do this process within 15 minutes on the local. I was quite skeptic, and then I saw the first cases during the training in Belgium, and I was quite impressed how easy it was and how fast the patient was recovering from the surgery, and the result was just natural. Just like the patient wants something natural, they don't want something obvious. Mia just offered the perfect procedure to this kind of patient.
But what is new about Mia? I mean, breast aug under the axilla has been there for so long. I mean, what's revolutionary about it?
Revolution is about the technique itself, the tools that have been developed, the new implants that have been developed, and the fact that this is all standardized. So when you've been trained for Mia, you follow certain rules to achieve the result you want. And it's consistent, is repeatable. So the moment you learn a technique, you just do it, I can say bluntly, because it's so easy and so smooth. And the recovery of the patient, because we are here to talk about the preservation of the tissue, and the tissue is completely preserved. So the moment you preserve the tissue, the recovery of the patient is in the blink of an eye. So I'm really impressed by that.
Amazing. And you mentioned under local. Maybe you can enlighten us a little bit. So what's the difference, local sedation, general anesthesia? What is the difference, so that the audience can better understand this difference?
So local is just an injection that we do, that the surgeon does on the area that he will operate. There is no IV, nothing. It's purely local product. But the patient can have some feeling. They can feel that we are working without any pain, but they can have some feeling. The sedation, IV sedation, makes the process more comfortable for the patient. They are just sleeping. They don't remember the moment when we do the surgery. And the general anesthesia, I think everyone knows it. You are fully asleep, and it comes also with the side effect of the general anesthesia. So local with IV sedation makes the recovery much more easier than the general anesthesia.
So what are your patients choosing when you say local anesthesia? Because I know you do a lot of local. So how do you feel the response is?
Everybody's shocked. Everybody's scared at the beginning. We said, oh my God, you're doing something on me, on my breast. What if I feel inside my heart, inside my chest? And then when they decide to go ahead with the local anesthesia, they absolutely are, amazed. I had a case a couple of days ago. The patient forgot to be fasting, so the moment she entered in the clinic, she drank a sip of water. And so she said, I cannot do sedation for you because... so she said, okay, let's go ahead. I don't want to postpone it. Let's go ahead with the local. And at the end, she said, I cannot believe I did it and how easy it was. I didn't feel any pain. I'm so grateful. She left after 10 minutes. Like when you go to the dentist.
And when you have to move to general anesthesia, in case you want, sometimes the patients do say, I want general anesthesia. Though it is not the main indication, obviously patients have to consent to that, correct?
Yes, but for Mia, at this point, after 1 year, I can tell you that no one actually wants to do general anesthesia. They come to you because they don't want the general anesthesia. So when they select Mia, it's just because they don't have the general anesthesia. So no request whatsoever so far.
Amazing. You both mentioned that your patients, your consumers are happy. So over the past year, what feedback have you been getting, especially now that you have some consumers who have performed Mia for over a year? What's the feedback after 1 year, let's say?
The feedback is very, very good. Patients are really happy of the scar, which is almost not visible under the armpit. They just don't feel the implant. It's just part of the breast, and they are. And the process was very easy for all my patients. So, yeah.
So I think there are many elements in terms of Mia that are different from the regular breast aug. And I believe, correct me if I'm wrong, it's addressing a new audience that probably did not consider breast aug before. So
Definitely.
What are your views on this one?
Definitely. It's a completely different pool of patients because they never consider to do a breast augmentation. They don't have time to do a full recovery. They have a busy lifestyle, they are businesswomen, mothers, whatever, and they just want something which is natural. Because remember, also breast augmentation world is going towards smaller implant. We don't want the big and visible implants like in the 90s. So the possibility to have this in 15 minutes and the local anesthesia with a fast recovery is very attractive to them. And again, it's something that is completely different from the audience of breast augmentation. They don't come to me and say, I'm not sure if I want a breast augmentation. The moment they come, maybe they hear Mia and I say, no, but I want bigger, then I shift immediately to breast augmentation, Preservé, whatever is the need. But most of the patients that come from Mia stick with Mia and want only Mia. And they accept the fact that the implant has a limited size because that's what they want, just natural results.
Correct. That's exactly what the patients are saying when they enter into the consultation room. They say, I would never do a breast augmentation. That I heard about Mia, which is different. So this is always the same.
If you both go back in time, you would still make the same decision?
Million times, honestly speaking, yes.
Yeah. You mentioned Preservé. So what are your thoughts on Preservé? Because I think it's a continuation of the journey that started with Mia and is complementary to Mia in terms of offering. So could you give us some insight?
My philosophy in surgery in general is the less we traumatize the tissue, the less risk we have, the faster is the recovery for the patient. And the fact that I have now in my hands a technique that gives me even more security, even more preservation, even more fast recovery for the patient is amazing. So I'm a very quick surgeon, not because I'm less precise with my patients, but because I believe in this, that the less I traumatize the tissue,
of course,
if I know what I'm doing, of course, if you don't know, you take your time and just do the thing properly. But with 20 years of experience, I can tell you that, I know what I'm doing, and even a traditional breast augmentation takes minimal time for me in my theater. But with Preservé, we can really not cut the breast tissue, preserve whatever is the woman body, and just enhance it. And with the different, of course, implants that we can use for that, it is absolutely amazing. So I'm very happy to start with Preservé.
Today we're gonna be officially launching Preservé. Dr. Lyor, your thoughts on Preservé? Excited?
Yes, I'm really excited because it's true that with Mia, sometimes patients can be frustrated with the sizes. So Preservé is just a great way to propose Mia patients a bigger size.
So let me address here this point. Probably they want Mia, but they miss the size.
Yes,
So now you can offer breast tissue preservation with a bigger size through a different technique. So we're also excited to launch today Preservé. I want to thank you both for your time. I look forward to enjoying the day with you, with a lot of fellow colleagues. And I wish you all the best with the Preservé journey now on top of Mia. So thank you very much, gentlemen.
Thank you so much.
Thank you, Andre. Thank you.
Thank you.